Did you just tear your ACL and had surgery? Well, in this video, I'm going to show you the must-do exercises that you can start in this recovery process so you can be able to get back on the field. And let's even start from the beginning, be able to walk better, and then be able to run and do the things that you like to do. So let's get started. Hey, this is Coach Miano with Propel Soccer, and this video is sponsored by Impact Care Therapy. So let's talk about ACL injuries. I have to tell you, this is one of my favorite topics to talk about. Now, an ACL injury happens whenever really we can either strain a ligament, the ACL is called the anterior cruciate ligament, that is inside our knee. And what it does, it allows your knee to be stable so that whenever you are maybe running or jumping, your knee is not shifting back and forth. Unfortunately, what happens, sometimes the ligament can get overstretched and unfortunately even torn. So you might have just had surgery to actually get a new ACL, a new ligament inside your knee so that your knee can now be stable again and be able to do the things that you want to do. Now, I would say in the very beginning, I know it might be uncomfortable. You have a lot of pain in your knee, maybe even swelling, but it is important to start the rehab process immediately. So you just had ACL surgery. The first thing that we want to start doing is getting this muscle, the quad, to start firing and working the way it should. So this is what we're going to do. This exercise is called a quad set. And what it is we're going to assume that this is the knee that I just had ACL surgery. We want to make this muscle work. So what we're going to do is we're going to take a towel. I'm going to take a towel and place it underneath the knee. Okay? Now what we're going to do here is make this muscle work by pushing down into the towel with the back of the knee. We push down, we call it quad set because you're going to push down and hold the position for about 3 to 5 seconds. And then relax. Push down again. It's gonna feel like you're not really doing much, but over time, you're conditioning your brain and the muscle to work the way it used to before the surgery. And relax. You can progress this by placing a roll underneath your foot or underneath the lower part of your leg, so you have more distance to push down. Might be a little bit challenging, but it's super important to get this knee to work, this muscle to work, and also get the flexibility of straightening out your knee out. Placing a bolster underneath your knee, and what we're going to work on is lifting your foot up to extend your knee. Go down. Go up again. Hold it for about 5 seconds, and then go down. Keep your knee on the bolster, so when you're lifting, you're gonna feel like you wanna do this. No, keep it right there. Bring your foot towards you when you straighten out your knee out, and then back down. You may progress this exercise by moving forward on the table. Now this part is more advanced, so you might need to wait for about a week or even 2 weeks before you attempt this one. So again, the knee starts from a down position in this case, and then you're going to be lifting up to straighten out that knee out. You might be able to use the other foot if it feels like it's too far down to support it, so you don't have to go all the way down. Hold it with the opposite foot and then lift up. Down. Maybe even keep a little bit of assistance with the opposite foot, but you're really trying to work on using the side that you just had the surgery. Then back down. what we're going to be doing is exactly what the exercise is called. We're going to lift one single leg up in the air, up and down. This exercise is super important because I know now after you just had the surgery, it's very hard to even lift up the leg to put it on the table or in bed or even get in and out of the car. So if you can work on this exercise, it will help you be able to move your leg up and down with much ease. So this is how it goes. We assume that this is the knee that just had surgery. We're gonna bend the opposite side. What we're gonna do here is we're gonna push down into the table and lift up the whole leg as much as you can, keeping the knee straight. I recommend lifting to the same level as the other thigh and then slowly back down. Up again. And then slowly back down. And in some cases, going down is even more difficult than going up. Again. And back down. Try to keep the knee as straight as you can and the foot towards you. This exercise is very important. It's called heel slides. It's important because now we're going to start working on bending your knee after you've had ACL surgery. So how do we start? You're going to place a towel on the bed underneath your foot. Now what we're going to do here is slowly slide your heel towards you. Okay? So it's going to require using some of these muscles here in the back. A little bit of assistance with your hand is okay in the beginning, but we really want you to be able to do it. And then just go to the limit of where you feel that tightness whenever you're bending your knee. And go back straight. Okay, slide again. And the towel is there just to make sure that it's easy to slide your foot. And then straight again. And we go up. Towel there a little bit, slide up, then back down, slide up again, and then back down. This exercise is called total knee extension, and what we're trying to achieve is to get full ability to extend the knee, and even actually almost hyperextend the knee in this case. So what we're going to do is you're going to take a resistance band and then put it around your knee, and the goal here is to straighten out your knee out against that resistance. When I do that, I'm making my quad muscle work. Hold it for 5 seconds and then you release. Same thing here, push back, 5-second hold and release. If you can take more resistance, you can move back a little bit more. Push back, hold it 5 seconds, and release. Hey, I hope you got value from those exercises and you're on your way to start recovering from your ACL surgery. It's important that you start performing these exercises immediately. I want you to remember that you need to first follow the protocol that has been provided by your surgeon after you've had the ACL surgery. This is just a guideline, but I want you to be cautious first and progress accordingly. Hey, remember to subscribe to the channel and ring the bell so you can be notified when the next video comes out. I'll see you on the next one.